I'm gonna come in and provide some privacy. Wash my hands here. Hi, my name is Lizzie. I'm gonna be your student nurse today. How are you doing today?
I'm good.
Okay. Can I have you confirm your name and date of birth?
My name is Betty Jones, and my birthday is 5/21/1952.
Okay, Betty Jones, 5/21/1952. That looks correct, and I see you have your red armband on, so we're getting ready. So let's see. I've gathered my supplies. I've got my blood transfusion tubing, my normal saline, which just gonna confirm that it's correct. I have normal saline here because that's the only thing that can be ran with blood. No medications or no other IV solutions can be ran. I also have a flush and some alcohol prep pads. So we're just gonna check. I see that I have an order here from the doctor to administer 4 units of packed red blood cells. Is that correct?
Yeah, he talked about this morning.
Okay. So I have that order here. And then I see he already had you sign the informed consent, correct?
Yep.
Okay. So I'm sure he kind of went over this with you already, but I'm just going to go over some of the possible reactions that can occur with a blood transfusion. So reactions tend to be more rare these days because we screen everything closely and check to make sure that the blood types are correct, but blood transfusion reactions can still occur. Some of these transfusion reactions could be itching or hives, shortness of breath, a lot of different things, itching, hives, shortness of breath, and just basically anytime you feel different, you just let me know, because I just want to make sure that everything is going okay and there are no transfusion reactions occurring. If a transfusion reaction were to occur, I would stop the infusion, and I would contact your doctor and we would work together for further look you over. But I would just make sure that the administration would be stopped.
Okay.
So now I'm just gonna check and make sure that your IV flushes and is patent before we call down for the blood, because we wouldn't want to get it and have to wait to start a new IV. Because the blood has to be started 30 minutes from when it arrives to the unit, because after then it can start to coagulate, the bacteria can start to grow. So that's why we start it within 30 minutes of it arriving, as well as the tubing that we're using. It's only good for 4 hours. So if the transfusion would have to run for longer than that, we would just have to be mindful and change the tubing. So I just re-washed my hands. I'm putting on my gloves. I'm gonna make sure that your IV is patent here. I'm just going to make sure that all of the air is out of my IV flush, and it is. And I'm going to cleanse my port before I flush. So I'm going to cleanse for 15 to 30 seconds. I'm going to allow that to fully dry, and then I'm going to attach my flush just to make sure. And it flushes well, so I'm going to disconnect this and we would toss that in the garbage. Take my gloves off. That looks good. Just gonna wash my hands again and switch my gloves to set up your tubing here, your normal saline, just to be safe. Your IV, I saw on your chart that it's a 20 gauge, and then that's good because we need an 18 to 22 gauge to administer blood, just to make sure that the blood cells would fit through the catheter. So that's good. We don't have to worry about that at all. So I'm gonna make sure that my port is closed. There we go. Okay, so I've got my sodium chloride, my normal saline, and I'm just gonna spike the bag here.
teddy bear first, to calm the child and so they understand the procedure. I will leave it
Okay, so I spiked my bag. Hang that up.
I'm going to document the site, the size of the needle.
Let's see, make
Wash
sure
my hands first.
that my saline port is open, and it is. So I'm going to prime this tubing. I'm going to make sure the fluid comes up above the level of the filter because that we don't want the red blood cells to hit the filter and lyse. So this just is an added layer of protection for that. And then I'm going to prime my tubing. Now, while I'm priming it, if we were administering blood to like a child, since the procedure can be pretty long, we would come up with some distraction techniques, maybe some activities that the child could do with their free hand or games that they could play to kind of pass the time a little better, because I know this can be like difficult for the child, especially if they're not feeling well. So we just kind of provide some emotional support. I'm going to prime this line, get all the bubbles out.
I would just check, I think otherwise I should be able to tell like how many minutes I'll watch it, maybe I made it in 2 minutes.
Okay, now the bubbles are out.
Anything else that you can think of?
Okay, I've got my cap here, which I kept clean. So we're just gonna hang this up here for now, while we're ready to get the blood. Let's see. So, I think I'm ready to have the other nurse send the blood up from the blood bank. So I have the nurse sent it up as well as our comparison form. So I'm just going to confirm with another nurse. Can I have you state your name and date of birth again?
Betty Jones, 5/21/1952.
Betty Jones, 5/21/1952.
And I have Betty Jones, 5/21/1952.
Okay. So we're just going to go through everything. You said your blood type was B positive again?
Yep.
Okay. And then the medical record number is 224466.
And I have 224466.
The location is the HLRL.
I have the HLRL.
Account number 123456.
I have account number 123456.
Patient name Betty Jones
I
again.
have Betty Jones.
Okay. Red armband number, which I'm going to compare, is 456654, and we have 456654.
And I also have 456654.
There's 4 units in the pool.
4 units in the pool.
250 milliliter volume.
250 milliliter volume.
Packed red blood cells is the blood component.
Packed red blood cells.
Okay.
Blood component. Yep.
The expiration date and time is 11/21/22 at 1500.
I have expiration date at 11/21/2022 at 1500.
Donor blood type is O positive.
I have my donor type is O positive.
Okay, and then before, I don't know if I said it, but the patient type is B positive.
Yep, patients B positive.
So the compatibility test was completed.
Compatibility test complete.
Date is 8/26/22.
I have date 8/26/2022.
And then a session number 1,
Session number 1.
tech LHRN.
Tech initials LHRN.
Okay, thank you. And I would have both of us sign off on that. And then, so the patient's RH status is positive, as well as the donor's, which is O positive. O is the universal donor, so this would be compatible for the patient to be able to use safely, which I'm just gonna confirm again. I'm just gonna look around, and I don't see any floaters, imperfections, no coagulation, anything abnormal going on in my IV bag for the blood. So, okay, cap was on, so everything is still sterile. I'm going to wash my hands again. Get some gloves. Okay. And then I'm just gonna, since I've got my clean gloves, clean hands right now, I'm just gonna feel your IV site. Does that feel any pain or anything around the IV site?
Nope.
I don't see any redness, no signs of infiltration or anything, and we already flushed it, so it is patent. I'm gonna make sure that this is open, and it is. So now, so I would, before I hooked this up, I would get a set of baseline vital signs, baseline lung sounds, and then I would also get them at the time of administration, as well as 15 minutes and then 30 minutes based on the facility policy for vital signs, just so we have something to compare to if change of condition were to occur. And as I stated, I'm gonna stay with you for the first 15 minutes. So what we wanna do is make sure the saline line is closed. Let's see, here we go. Blood line, we're gonna open it up, and the saline line, we are going to lock it. So this way we get our blood rather than our saline running through. And I'm gonna prime the blood to the end of the tubing. We do this just to make sure that you're getting blood right away. Rather than waiting, because I want to assess and monitor how you're doing throughout the process. So if you're not getting blood right away, it would not be helpful for us. Let's see, where is my end here? So, I'm gonna open this up. And I'm going to open my roller clamp and prime the blood to the end of the tubing without losing any blood is our goal, because we need you to get all the blood you can. So I'm just gonna prime the saline out of the tube. Just gonna switch hands without contaminating anything, get everything. I'm gonna hang this up while I do this, so I have an extra hand. There we go. Now we're cooking. Okay, I'm gonna watch that the blood comes down through the end of the line, and as soon as it gets to the end, I'm going to clamp it off, and we did not waste any blood. So that is good. So now I'm going to cleanse our port again. Yeah, and then if a transfusion reaction were to occur, I'd stop it. Oop. And I touched it. So let's just clean this. And make sure that fully dries. I would connect my tubing. Okay. So then, now it looks like I got everything good for now. So, I'm going to get our pump ready. Sometimes it kind of depends on facility policy, but the rule of thumb is to start at 50 milliliters per hour, just to see how you tolerate the procedure. And then once we know that you're tolerating the procedure well and you can kind of handle an increase, we'll increase it based on what you can handle. So a new patient, yes. So channels, guardrail IV fluids, we're gonna page down. Blood, RBCs, which is correct. And then for our rate, we're gonna do 50 milliliters per hour to start, like I said. Before we confirmed that our bag had 250 milliliters, so I'm just gonna set it at 225, which would give me a warning when it is about to be done, so we don't run dry. I'm gonna make sure my line is open and we're running. So now I'd stay with you for the first 15 minutes. Take a set of vitals now just as the infusion is starting. And then I would also take a set to compare 15 minutes, as well as listen to your lung sounds. And then after that, if I see you're tolerating it, I'm gonna increase the rate. And now if it was a child, we'd consult with the doctor to see what an appropriate rate was, or an elderly patient, because they might not be able to tolerate such a high volume, but it really depends on the patient and the facility policy. I'm going to clean up my garbage, toss this all, put this, take this with me, put it in the chart, clean up my supplies. This would also go into the garbage. For practice purposes, I'm just gonna put it in the bin. So, you're feeling good?
Yep.
Okay. So now I'm back in the room, and my patient, his blood has just finished. So what we're gonna do is pause the infusion. We're going to clamp off this blood area and open up the normal saline. We do that because we're going to switch the pump to normal saline. We can run about 50 milliliters just to clear out this line because there's blood all throughout this line. So I would program the pump to flush this out and make sure the patient is getting all that blood. And like I said, 50 milliliters should be good to clear that line. Let's see. So that once that is done and the line is clear, I would get some gloves, I disconnect, but while that would be running, I'm gonna wash my hands. Do you need anything else from me?
I don't think so.
Okay, I'm going to lower the bed to a safe position. I'm going to make sure you have the call light, the patient is safe and comfortable, and we are good to go. Thank you.